Good morning, Dr. Morning, everybody. Dr. Patmos here. It is April the 20th, 420 day. And I wanted to do a quick update on some data that I saw this morning about who is getting the flu shots and who is getting COVID vaccinated these days, especially among healthcare workers, doctors, and other people like that. And here's the latest data. This is for the 2025 season. Obviously, we don't have data yet for the 2026 season. So the most recent data is for 2025. And here's what we find. Overall, about 76.3% of healthcare providers have received the influenza immunization. That rate was 94.6% among pharmacists, 92.6% among physicians, and 88.3% among others working in hospitals. It drops to 70% for aides and assistants. And among other groups, it turns out that the highest rates when you look demographically overall. Oh, let me switch to COVID for a second. COVID vaccines, the rate drops down to 40.2% overall and 46.7% for MDs. That's in 2025 working in healthcare settings. Now, overall, the highest rates were found among people with advanced degrees, 81.7%, and Asians at 89.2%. Now let's compare that to U.S. adults in general. U.S. adults in general, as for flu immunization, the rate is about 45%, higher in the elderly at 70%. For COVID immunization, it's 27%. So overall, half of the general public decline flu and COVID vaccination. So there's an interesting comparison here. In healthcare, among healthcare workers, the rate of immunization for influenza and COVID is basically twice as high as it is in the general public. And what you see within the healthcare workers, the higher the level of education, the more likely they are to be vaccinated. Another important factor turns out to be whether or not the hospital requires it or just encourages it. And it turns out that most hospitals do require influenza immunization, but most do not require COVID immunization. I also included some data in the text below on some of the demographics of those who, in the general public, who are vaccinated and who aren't, and it's clearly higher among highly educated urban people and left-leaning populations, and lower among Republicans and rural people and less educated. So there's clearly and this pattern has been evident now for quite some time. The more highly educated you are, especially if you're in healthcare, the more likely you are to be vaccinated. Now, why would a hospital mandate vaccination for COVID? They don't have to. It's not required that they do. Why would a hospital do that? Why would an insurance company cover it? We know that they're required to cover it if it's recommended by CDC. But why would a hospital require immunization of their workers? Find out in the next video.